The Ministry of Health last week announced plans to start mass testing of Kenyans, an exercise that has not taken off due to lack of adequate testing kits. Early morning at the Jomo Kenyatta International Airport, KQ Boeing 787 Dreamliner touched down. On board, an assortment of medical supplies from China that the government procured to upscale efforts to break the COVID-19 transmission chain, clearing the way for government to kickstart mass testing of Kenyans.
These 200,000 sampling tubes are key to our ability to mass test Kenyans. Without these sampling tubes, we would not be able, and we were not going to be able, to start our mass testing.
The consignment had an additional 500,000 three-ply masks that the government will prioritize for frontline workers, and 76,000 N95 masks were also delivered Friday morning. The equipment also included 4,000 pieces of shoe covers, as well as 300 pieces of static shoes for the frontline workers. The government says it has also procured additional ventilators awaiting shipment.
There is another flight leaving tomorrow on Saturday to China to also bring medical supplies, and there will be many more.
The Ministry of Health has already trained the aviation teams who jet in and out of the country to collect medical supplies, as well as laying down protocols to be followed.
We have developed protocols with them on how to travel, on how to quarantine themselves, the crew. When they come and when they go, they know what to do.
12 more cases were reported today, with the numbers now at 246.
5, for example, are hotel workers, and another 4 from our sampling, from our contact tracing capability.
In comparison with other global nations with a similar infection curve as Kenya, the government says the situation could turn bumpy depending on the outcome of the mass testing.
Looking at what is happening around the world, we have reason to be concerned, we have reason to be prepared.
The government is targeting quarantine centers, hotels, isolation centers, and hospitals to first undergo the testing. In Mombasa, the ministry is deploying 1,000 testing kits to the Kenya Ports Authority that has also recorded a good number of positive cases in the coast region. A total of 12,000 testing kits is earmarked for deployment for phase 1 of the mass testing, with Kibera slums identified as the first urban settlement to face the test.
We have introduced, for example, 107 water points. We have also closed down Badali and Kipevu clinics to make sure they are properly fumigated, to make sure that we do not have any further transmission.
In addition, the government from Monday will begin another round of inspections of all isolation centers in the country to establish their capacity and readiness to hold infected persons who will be identified during the nationwide mass testing.
As you know, what lies ahead is a challenge. And everybody knows that.
Already, mass testing has started for frontline workers, with the government already earmarking priority areas. Counties that have already been marked as hotspots lead the pack. Stephen Leto, Citizen TV, Nairobi.